Diabetic retinopathy means patients who are affected with diabetes tend to get affected with the retina also. Retina is basically our nerve layer of the eye. So when it gets affected, our vision drops. So diabetic retinopathy can manifest as bleeding in the eyes, fluid leakage in the eyes, as well as retinal detachment. So usually patients who are affected with diabetes for more than 5 years tend to manifest with some kind of pathology in the retina as well. So the vascular changes, that is the retinal arteries and veins, sometimes tends to get blocked because of chronic diabetes. So there will be microvascular leakage, that is the small vessels of the eye, that is the capillaries, tends to get blocked and sometimes rupture, also causing leakage of the blood as well as fluid. If this leakage is chronic, it tends to cause more changes in the retina, which can include new abnormal vessel development, which is not beneficial for the eyes. So this abnormal blood vessels tend to leak blood as well. And this can cause vitreous hemorrhage or sometimes called bleeding in the eye. And sometimes if the leakage is chronic, it tends to promote abnormal growth in the eye. And this abnormal fibrovascular growth, which we tell, tends to pull the retina and cause retinal detachment as well. Diabetic retinopathy can be prevented only if diabetes is strictly controlled and we make sure that we are aware of diabetic retinopathy even before the retinal changes start. But once the retinal changes start or pathology starts, we cannot tell it can be reversed. It can always be stabilized at that level. So the final answer will be yes, diabetic retinopathy is preventable, but it cannot be permanently cured if it is already started. Diabetic retinopathy can be treated with various modes of treatment. The most common mode starting from the basic level is number 1, retinal laser, number 2, intravitreal injections, and number 3, vitreoretinal surgeries. So retinal lasers are the OPD based procedures which will be usually given in multiple settings, and it will be done in OPD. Whereas intravitreal injections are basically medicines which we tend to give inside the eyes, and these are microscopic injections, so there will not be usually any pain associated with it. But since these are medicines, they have their limited duration of action, and sometimes we need to give multiple injections over a period of time. Now the vitreoretinal surgeries are usually major surgeries for the eye, where the surgeon goes inside the eye to clear up all the bleeding and all the fibrovascular proliferations, and sometimes to settle the retina which has been detached. So as I said earlier, retinal lasers are the basic form of treatment. If the pathology is not responding to this treatment, then we go to the second level, that is the intravitreal injections. If the disease is still not responding, then we'll go for the third level, that is the vitreoretinal surgeries. Sometimes when the patient presents, we can directly start the treatment from the second or third level also, based on how far the pathology has progressed in the eye.